Want stronger legs even at 100? Your muscles need this now. If your ankles leave deep dents when you press them, if your socks cut into skin and your legs feel heavy like stones at the end of the day, that's not just getting older. That's fluid that should have been moved out by your circulation but stayed behind, a sign of venous stasis and leaking capillaries. Tonight, I'm going to walk you through a 7-step bedtime routine you can do at home that targets the root causes, not just the symptom. These steps focus on restoring electrolyte balance, recruiting the calf muscle pump, your body's second heart, and supporting venous walls while you sleep. Stick with me for the full sequence. It's short, precise, and many people notice real relief by morning. If you want step-by-step nightly routines for stronger legs, tap like and save this video now. Why this matters? When veins don't efficiently push blood back to the heart, fluid pools in the lower legs. That pooling stretches veins and capillaries, lets fluid leak into the tissues, and makes the legs heavy, tender, and prone to skin changes. Left unchecked, sluggish flow raises the risk of blood clots in the deep veins, DVT. I don't want to alarm you, I want you to act. The good news, nightly, targeted actions can reduce the fluid load, retrain your calf pump, and give your vascular system a chance to repair while you sleep. A note on safety before we begin. If you have known kidney disease, unstable heart conditions, are taking potassium-sparing diuretics, ACE inhibitors, anticoagulants, or you have active leg infection, severe peripheral arterial disease, or any sudden and severe unilateral leg swelling with pain and warmth, stop and seek medical attention. Always check with your clinician before changing potassium or magnesium intake or starting venous supplements. I'll remind you about those checks at each relevant step. Step 1. Pre-sleep electrolyte flush, magnesium plus potassium. Why? A small cellular electrolyte shift helps cells release sodium and water, making fluid easier to move out of the tissues. How? About 60 minutes before bed, mix approximately 1 teaspoon of magnesium citrate powder into about 12 ounces, a cup and a half, of water. That amount is intended to provide roughly 300 to 400 milligrams of elemental magnesium, a common effective range. Add about a quarter teaspoon of cream of tartar, potassium bitartrate, as an optional potassium source if your doctor has cleared you for extra potassium. Stir, drink it slowly over a few minutes, then wait an hour before lying down. Safety. Do not do this if you have significant kidney disease, if your clinician advises against extra potassium, or if you take potassium-sparing medications. If you're on diuretics or heart meds, talk to your clinician before trying this. Note for the writer, cream of tartar as a potassium source is sometimes listed as potassium bitartrate. If this needs confirmation, mark indefinir.
Step 2. Contrast foot baths. Trigger the hunting response. Why? Alternating warm and cold stimulates vessels to open and then constrict, which moves blood toward the center and kickstarts lymphatic drainage. How? Set up 2 basins, one hot water you can tolerate, hot but not scalding, as hot as you can hold your feet comfortably for the time, and one very cold with ice, cold enough to feel a strong constriction but stop if you experience numbness or sharp pain. Immerse both feet in the hot basin for 3 minutes, then switch to the cold basin for 60 seconds. Repeat that hot then cold cycle 3 times total. While in the hot basin, breathe deeply and visualize warmth moving upward. When you switch to cold, allow your breathing to steady. Safety. If you have diabetic neuropathy with reduced sensation, severe peripheral arterial disease, or wounds on the feet, skip the icy portion or check with your clinician first. Stop immediately if you experience severe pain or skin color changes. Step 3. The non-negotiable 5-minute legs up active pump. This is the your muscles need. Why? The calf muscle compresses veins and acts like a second heart, pushing blood back to the torso. Doing an active pump while the legs are supported magnifies venous return without straining the heart. How? Lie on your back and put your legs up against a wall or over the arm of a couch. Your hips should be slightly elevated if possible so the legs are above heart level. For 5 minutes, actively point your toes away from you for 5 seconds, then flex the ankle toward you for 5 seconds, repeating that alternation continuously. That pattern, 5 seconds pointing, 5 seconds flexing, creates sustained, deliberate calf contractions and refill veins. If counting in seconds is hard, aim for a steady rhythm of slow point and flex, totaling 5 minutes. This is the single non-negotiable habit, 5 minutes every night. Safety. If you feel lightheaded lying flat, raise your torso slightly or perform seated versions. Sit and rhythmically press the balls of the feet down and release to simulate the pump. There is a note to confirm cycle recommendations. Some sources list faster rhythms, e.g. 10 cycles per minute. Because the transcription varies, mark this timing detail as indefinito if confirmation is needed, but the 5 seconds method is safe and effective for most. Step 4. Topical venotonic massage, cypress and rosemary blend. Why? Certain topical botanicals may support venous tone and soothe the skin. Massage itself moves fluid toward the heart and improves lymphatic flow. How? Mix about 5 drops of cypress essential oil and 5 drops of rosemary essential oil into 1 tablespoon of a neutral carrier oil, for example, fractionated coconut oil, jojoba, or sweet almond oil. Warm the oil in your hands and then, starting it to flood, use moderate upward strokes toward the knee. Never press down or massage directly on a tender area.
Each leg gets a gentle 3 to 5 minute upward massage, ending just below the kneecap. Avoid massaging if you have an active skin infection, open wounds, or deep vein thrombosis. Safety. Always dilute essential oils in a carrier. Do a skin patch test first. If you take anticoagulant medication, check with your clinician before regular deep massage or using certain essential oils. If you notice redness, increasing pain, or unusual warmth after massage, stop and see your provider. Step 5. Nighttime low-grade compression. Why? Light compression reduces overnight pooling and gives veins gentle external support while you sleep. How? Choose socks labeled for 8 to 15 millimeters compression for overnight wear. These are very light support socks, not the daytime medical-grade stockings. Put them on before bed after the leg rub. Check fit. There should be no pinching, no tight bands that change skin color, and you should be able to slide 1 or 2 fingers under the top band. If the sock leaves deep rings or causes numbness, remove them. Safety. Do not use higher grade compression, 20 to 30 millimeters or above, overnight, unless specifically prescribed and supervised by a clinician. If you have severe peripheral arterial disease or uncontrolled heart failure, ask your clinician before using any compression. Step 6. The 3-hour pre-sleep fluid fast, with a small exception. Why? Stopping large volumes of fluid a few hours before bed gives your kidneys time to process and remove excess volume, reducing the burden of fluid that might pool while you sleep. How? Plan your last substantial drink about 3 hours before your usual bedtime. For example, if you usually sleep at 10 p.m., finish large or caffeinated drinks by 7 p.m. That doesn't mean you can't take a tiny sip to swallow your bedtime tablets or supplements. More on that in a second. If you need to take a nightly medication with water, take the smallest sip necessary and time it so your main fluid intake has stopped 3 hours prior. Safety. If you have conditions that require precise fluid intake, for instance, certain heart or kidney conditions, follow your clinician's guidance on fluid timing rather than a general rule. Step 7. Nighttime venous repair supplements. Horse chestnut seed extract plus pycnogenol. Why? During sleep, your body repairs tissue. Certain supplements may support capillary integrity and venous wall strength. How? Take HCSE, horse chestnut seed extract, 300 milligrams, standardized to Acene, 50 milligrams, plus pycnogenol, 100 milligrams at bedtime. Take them with a very small sip of water, just enough to swallow, so you respect the 3-hour no large fluids rule, but still get the supplement. Safety. Do not start these without checking with your clinician if you have impaired kidney function, if you are on anticoagulants, blood thinners, or if you take medications that interact with supplements.
Horse chestnut and pycnogenol can interact with blood-thinning medicines. Always confirm safety and dosing with a medical professional. Note for the writer, confirm spelling or standardization for pycnogenol and any brand guidance. If unclear, mark indefinito. Putting the whole sequence together, timed example. Imagine you plan to sleep at 10 p.m. At 8:50 p.m., prepare your magnesium citrate plus cream of tartar drink and consume it by 9 p.m. At 9:15 p.m., do the contrast foot baths, 3 cycles of 3 minutes hot, 60 seconds cold. At 9:30 p.m., get into position for the legs up active pump, 5 minutes of deliberate 5 seconds point, 5 seconds flex contractions until 9:35 p.m. At 9:40 p.m., warm the Venatonic oil and do a 3 to 5 minute upward massage on each leg, finishing by 9:50 p.m. Put on light 8 to 15 millimeter mercury night socks before turning off the lights. Stop large fluids by 7 p.m., but take your HCSE 300 milligrams plus pycnogenol 100 milligrams at about 9:55 p.m. with a small sip of water. That sequence keeps the steps in order, gives the physiology a chance to act, and nests the supplements into the bedtime window. Practical technique cues to make it easier and safer. For the contrast baths, use a kitchen thermometer if you like. Hot should be as hot as tolerable without burning. Cold with ice should feel sharp but not numb. For the oil massage, keep strokes firm but gentle and always upward toward the heart. For the compression socks, sit and gently pull them on, smoothing wrinkles. If you struggle to get them on, choose a pull-up style or ask a caregiver for help. Never force a tight sock on. For the legs up pump, if you're a side sleeper who can't lie on your back, lie on your side with the top leg elevated on a pillow and perform seated or standing calf presses instead. The key is active contraction. One habit killer to avoid: crossing your legs for long periods. Crossing clamps the femoral area and reduces venous return. If you're a frequent leg crosser, consciously replace that habit with a foot rock or short calf contraction every 10 to 15 minutes. Also be mindful of prolonged sitting. Stand up and march in place for a minute every half hour if possible. When to seek medical attention. These nightly habits are aimed at chronic bilateral swelling and improving circulation. If you experience sudden, severe swelling in one leg, intense calf pain, warmth, redness, or shortness of breath, seek immediate medical care. Those can be signs of deep vein thrombosis or pulmonary embolus. If your legs are painful with fever or rapidly worsening redness or tenderness, see your clinician promptly. If you have a chronic condition like kidney disease, unstable heart failure, or are on blood thinners, consult your clinician before starting the supplement routine or the magnesium-potassium flush. What to expect and how long it will take. Many people notice less volume and a lighter feeling the morning after the first night. The contrast therapy and pump can shift fluid quickly.
Meaningful structural improvement in vein tone and capillary integrity takes consistent nightly practice over weeks to months. Think of these 7 steps as nightly training, small daily investments that add up to more comfortable, stronger legs and better mobility over time. Common questions I hear. Answered. Will this cure varicose veins? No guarantee. Topical and oral supports can help symptoms and support vascular health, but large varicose veins may need specific medical treatment. Can I skip the magnesium? The electrolyte step helps many people with fluid handling. Discuss with your clinician, especially if you have kidney issues. Can I do the pump during the day? Yes. Sit-to-stand calf raises or marching in place are an excellent daytime complement. Are essential oils safe? When diluted and used with appropriate precautions, many tolerate them well. Avoid essential oils if you have known sensitivities or open wounds. A final practical checklist you can memorize. 1. Magnesium plus optional cream of tartar 60 minutes before bed. 2. 3 cycles of hot 3 minutes, cold 1 minute foot baths. 3. 5 minutes legs up active pump, 5 seconds point, 5 seconds flex. 4. 3 to 5 minute upward venotonic oil massage. 5. Light 8 to 15 millimeter Hg night socks. 6. Stop large fluids 3 hours before bedtime. 7. HCSE 300 milligrams, ASIN 50 milligrams standard, plus pypnogenol 100 milligrams at bedtime with a small sip. Remember the key warnings. Check with your clinician about potassium and magnesium changes. Avoid this routine if you have active infection or DVT signs, and don't use high-grade overnight compression without prescription. Start tonight. 5 minutes of targeted calf engagement while your legs are supported is the core action your muscles need to start restoring stronger legs. It's short, inexpensive, and safe for many older adults when done with the precautions I described. With consistent nightly practice, you can expect morning relief and progressive improvement over weeks. You deserve legs that feel lighter and let you move with confidence. If you want the next video, 3 foods silently wrecking vascular elasticity, click to watch next and subscribe. And again, if you have sudden severe swelling, intense unilateral calf pain, or signs of infection, seek urgent medical care. For everything else, start gently, check with your clinician for any medication or kidney-related concerns, and make the 5-minute pump a non-negotiable part of your night.